Hi, I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, online at tailbonedoctor.com. And here I'm going to explain the difference for x-rays of the front view and the side view and why that's important if you have tailbone pain. So just to sort of orient you for starters here, this is a plastic model of the pelvis, and this is looking at the pelvis from the front. Here you're looking at it from the side, and now you're looking at it from the back. And the tailbone is right down here, and the larger bone above that is the sacrum. And the easiest way to show this is without showing the entire pelvis, but just showing here the sacrum, and then down below that is the coccyx or tailbone. So now you're looking from the back, and this is from the side, and that's from the front. I'm going to draw these here just to give you a sense of what you're looking at when you look at the sacrum and coccyx. So the sacrum, and I'm no great artist, but the sacrum is sort of like that. And then the tailbone is down below it. The sacrum has 5 segments, 1, 2, 3, 4, 5. And the sacrum is essentially fused together into one solid bone. And then the tailbone is more variable. It's much smaller than the sacrum. As you can see here, the sacrum is much smaller. And it's usually anywhere from 3 to 5 bones. They may or may not be fused. Now, if you look at it, so that's basically looking at it, sort of from the, from the front, or back in that particular plane. How about if we look at it from the side? Well, that'll look something a little more like this. It has a curve to it, and it's bigger at the top and gets more narrow, down at the bottom. And then we'll draw the coccyx down here, roughly continuing, that curve. I'm going to move this camera because there may be a little glare there. Okay, I think it made it worse. All right, there we go. All right, so basically, that, and again, the sacrum, with its, 5 segments, and the tailbone with anywhere from 3 to 5 segments. Again, the tailbone, being much, smaller. So, how is this relevant when it comes to getting the proper X-rays? Well, if you get X-rays that are done in the front view. So basically, in medicine, they call that a frontal view, or they may call it an AP view for anterior to posterior. Then, there's some things that can come in the way of getting a good view of the tailbone. So let's take a look at those. So basically, if we, look at our front view here, well, in that view, because we're taking the X-ray like this, number one, you can see here how the pubic bones up in the front of the pelvis can block the view of the coccyx. So right now, from your vantage point of the camera or your eye, you can't see the tailbone at all. So first thing that the radiology technician needs to do is to tilt the camera angle so that now you can see the coccyx back here. Whereas without that tilt, if they do a straight AP view or front view, they can see most or all of the sacrum, but would not be able to see the coccyx. So that tilt becomes very important. Even if they do the tilt, there's still problems with the front view. And I'll show you that here. Well, what's up in the front of the pelvis that's going to be in front of the coccyx? Well, there's the urinary bladder, the bladder where we collect urine before we pee. So that's going to be up here, and you've got some urine in there, so that's going to sort of block the view. The other thing that's in front of the tailbone is the uterus in women, and in men and women, there's the rectum or colon, the part of the large intestine where stool collects, feces it collects before having a bowel movement. So basically now you've got your stool collecting in that area. And now you can see why you're going to have a tough time on that front view really getting a decent detail in your imaging of the coccyx. So now let's take a look. I'm going to change this camera angle to avoid the glare a little bit. So now let's take a look from our side view. Well, on our side view, which is over here, this is behind you, and this is inside of your pelvis. Well, the bladder would be all the way up front here, and then your colon would be here, with its stool. And you can see now, unlike the view here from the front, where it's blocking the view of the tailbone, here at the view from the side, this is not blocking the view of the tailbone. The tailbone is still nice and clear. So I would say probably 99 times out of 100, maybe more, the side view is going to be much more helpful and much more important when it comes to showing the coccyx. So again, this is our front view, or in medicine we'll call that a frontal view, which is sometimes referred to as a AP view, which stands for anterior to posterior view. So that's there, as opposed to over here, where we have our side view, which in medicine, medically we call that a lateral view. Now this is different, this is now I'm talking about x-rays. This is different if we are looking at MRIs and CT scans, because those take images in slices. There are some corollaries for those, but I'll probably go into that in another video because it'll just get too long to say it all on this one. So the take-home message really is that unfortunately there's lots and lots of times where people have tailbone pain, and the only view that they order in the emergency room, or when they see their primary care doc, or even their musculoskeletal doctor, if the doctor is not experienced in treating tailbone pain, is that they'll get this, front view, which doesn't really show the tailbone very well at all, either because they didn't tilt to have the tailbone included, so then it's blocked, or they did the tilt, but even so, you're looking through the bladder, the uterus, the stool within the colon or rectum, all of that, and you really can't see the tailbone very well. And then unfortunately people are told, hey, we didn't see anything abnormal, so your tailbone must be fine, which is sort of misleading. It may be true that they didn't see anything abnormal, but they didn't see anything abnormal because they didn't get a good view of the tailbone in the first place. So really then what becomes much more important is to get this side view or lateral view for people who have tailbone pain, because that will typically show a lot more detail. Now beyond this, there's also having that lateral view done sitting versus standing, which we can talk about in another video, because that's really important as well, because there's lots of times where people may look normal while they're standing up, but when they sit and put their body weight onto the tailbone, which is usually when they're most painful, that they may have an abnormality or dislocation that only shows up on the sitting x-rays. But that's for another video. So on this one, just simple things first. Frontal view can help with some things, but really what's most important for people with tailbone pain usually is that side view or lateral view. And I see this very, very commonly. Patients fly in to see me from around the country and sometimes internationally. And there's unfortunately lots and lots of times where people bring with them their CDs, which I appreciate, and we look at the imaging that were done on, that's on the CDs of their x-rays that they were told were normal, years ago when they first started having tailbone pain, when the imaging were done, and we realize there's not a decent view of the tailbone to begin with. And that can be very frustrating, of course, for patients. So anyway, I hope this information is helpful for you. And if you want more information, you can find me online at www.tailbonedoctor.com. Or if you're looking for a copy of my book on tailbone pain, you can find that on Amazon, or the easiest way to find the link to the Amazon sites that sell it is if you just go to www.tailbonebook.com. Okay. Hope that's helpful. Post your questions or comments down below. Bye-bye.